Let's talk about breastfeeding in terms of trees. Imagine the trunk of the tree is breastfeeding. Breastfeeding is vitally important to supporting good health. It offers many benefits to many people. Let's add some branches to our breastfeeding tree. This branch is baby. This one is mom. This one is family. This is employers. And this one is society. You need these branches to get all the beautiful leaves, right? So what are the benefits? Or, for our purposes here, what are some leaves for baby? Leading health organizations strongly advise mothers to give breast milk only to their babies for the first 6 months and continue for at least 1 to 2 years. Babies who are breastfed experience many remarkable health benefits, including less ear, stomach, and respiratory infections, less diarrhea, reduced risks of obesity and diabetes, a stronger immune system, and optimal brain development. And how about for mom? What are some benefits for our mama branch? Breastfeeding promotes an early bond and closeness between mother and child. Breastfeeding mothers experience reduced risks of diabetes, breast and ovarian cancer, less postpartum depression, less cardiovascular disease, and a speedier recovery after childbirth. Families save time and money by choosing to breastfeed. A breastfed child is a healthy child, which means less money spent for medical visits for the family. And a breastfeeding mother is a healthy mother, which means she's back on her feet faster to spend time with the whole family. By supporting breastfeeding in the workplace, employers enjoy higher employee productivity and retention, lower healthcare costs, and less time lost for employees leaving to care for a sick child. Our entire society benefits from breastfeeding. By supporting more breastfeeding, the U.S. economy could save $13 billion a year. We would be taking a huge environmental step forward by reducing the waste involved in the production, packaging, and distribution of formula and bottles. Wow! Look at this wonderful canopy of leaves. But wait! We're missing an important part of the tree. We need roots. Without roots, a tree can't survive. There are 6 major groups outlined in the U.S. Surgeon General's call to action to support breastfeeding. Each of these groups can make a huge impact on promoting and encouraging breastfeeding. So, what are the roots that support breastfeeding? Mothers and families to provide the day-to-day support and encouragement. Communities to support breastfeeding without limits or restraints. Healthcare to provide necessary guidance and skilled help. Employment to remove the barriers to successful breastfeeding. Research to expand and deepen our knowledge of breastfeeding and breastfeeding support. And public health infrastructure to lead the nation with a focus on health. As you can see, this breastfeeding tree has a deep, healthy root system of support. So, where are you in this root system? How are you supporting breastfeeding? Because if we want to enjoy this canopy of benefits, then we need more breastfeeding. And if we want more breastfeeding, we need a healthy, vibrant root system. And this lone breastfeeding tree can become an orchard of breastfeeding trees. Get involved. Go to breastfeedla.org. Everyone can help make breastfeeding easier.